regions that have been listed in the motion: Coast Region, Eastern, Northeastern, Nyanza, Western regions, to complement the national referral hospitals that we have so far. Whereas I support that, I also have a different opinion about this motion. And that opinion is expressed in the second resolution that this motion seeks, which is seeking that the county government to allocate more funds to the respective health dockets to adequately facilitate their level 5 and level 6 hospitals so that they can enhance the provision of critical health services to reduce the demand of such services from the National Teaching and Referral Hospital. Madam Speaker, I have the benefit of being the chair of County Public Investment and Special Funds Committee, and we have been examining audit reports for hospitals in this country, particularly level 4 and level 5 hospitals. And Madam Speaker, I can tell you that if you look at the audit report for county hospitals, it is horrible. All manner of governance issues are in our hospitals. No wonder, Madam Speaker, every day I sit in this house, I hear members bringing statements on status of healthcare in this country, because our county hospitals are mismanaged. If it is the issue of how to manage staff, that problem is common across all county hospitals. Management of HR, issues of bloated staff, issues of unaccounted for casual staff, issues of lack of proper promotion and succession, issues of expired medicine, Madam Speaker. Why would medicines expire in the first case? It is because of the corruption that is in these hospitals. They would rather give a patient a prescription to go and buy drugs outside the hospital. And one common thing that has come up is that we have a proliferation of chemists around county hospitals. How are these chemists thriving? They are thriving because, Madam Speaker, they have easy market. The patients who come for service in those referral hospitals, in those county hospitals, are being referred to buy medicines outside. And then they end up buying medicines in the chemists that are connected to some of the health workers in those hospitals. And this is common in all the counties. I remember at some point, actually last year, the governor of Mombasa addressed this issue and said that they are not going to license any more chemists around Coast Referral Hospital. Because one, the issue of loss of drugs, the issue of drugs expiring in those hospitals. Madam Speaker, one of the other issues that have come up in our audit is compliance, Madam Speaker. Compliance to the health standards model. There is a model that has been given by the Ministry of Health to all county hospitals on the number of medical equipments that are required, on the number of health workers required in terms of nurses, in terms of specialists, doctors, in terms of clinic officers and all. Most of our county hospitals have not been able to comply with the Ministry of Health model on that, Madam Speaker. Madam Speaker, we have challenges around equipment leasing. Equipment leasing. The equipments that are in our referral hospitals, some of them are not functioning. Some of them are, the contracts that they have entered into are too expensive to be maintained. We used to have the MES, the Medical Equipment Leasing Program, that we saw in the last Senate. It was messy, Madam Speaker. But now it has been replaced by another one which is more messy, Madam Speaker, called the NES, National Equipment, System. It is more messy because it has increased the cost of healthcare in our hospitals, Madam Speaker. Madam Speaker, the issue of equipment, malfunctioning of equipment, maintenance of equipment, and even the cost, general cost of running the equipment in our hospital is so high, Madam Speaker, to the extent that basic services, Madam Speaker, like CT scan, patients have to be referred to private hospitals around the referral hospital, Madam Speaker. And yet, we appropriate a lot of money to our counties, Madam Speaker. Madam Speaker, there is a problem even with basic facilities in our county hospitals. Issue of cleanliness. Issue of even number of beds, Madam Speaker. Some hospitals you go there and you see patients sharing beds. Sometimes even patients sleeping on the floor, Madam Speaker. These are issues that we encounter, and I want to thank the Senate for giving us an opportunity as a committee to basically look at the audit issues in our hospital. And we'll be coming with a series of reports before this House so that the House can really understand what are the real challenges our hospitals are going through. Madam Speaker, even issues of financial management in our hospitals, you find that the county executive financial statement are intermingled with the hospitals. And the PFM is very clear that hospital entities are supposed to have their own separate financial statements so that they are audited separately. But you still find that assets for the hospital are still in the name of the county, or they are still in the name of something else. So I am basically trying to give the picture of the financial and the governance performance of our hospitals so that, Madam Speaker, when we say we want our county hospitals to be upgraded to referral hospitals, then we will be making sense. Because I've seen a proliferation of requests from counties that the county referral hospitals to become national referral hospitals. They are basically pushing the problem. Counties are basically saying that we cannot manage this, we are asking national government to take over. How can you become a level 6 hospital when, according to the auditor, you have not even met the basic standards of becoming even a level 4 or a level 5 hospital? I have seen a number of requests by our counties to convert their level 4 and level 5 hospitals into level 6. And basically, that is driven by the failure of our counties to manage healthcare. They want now to take it to the national government, so that pressure is not on them. Mr. Speaker, for that reason, I am very hesitant to support this motion that because our counties have failed to manage level 4 and level 5 hospitals, then we should now indirectly transfer that functions to the national government. We have been discussing here, Madam Speaker, on the need to have a comprehensive transfer of functions from the national government to the counties. We have been saying 80% of the health budget is retained at the national level. And yet, health is primarily a devolved function. But here, we are now saying as a Senate that now our hospitals should now be upgraded from the county level 4 and level 5 to become national referral hospitals at level 6. This is a contradiction, Madam Speaker. We cannot be pushing for the transfer of functions from the national government and at the same time indirectly transferring them back to the national government. Madam Speaker, I can see you are nodding, and I know you are strong chair of, vice chair of devolution committee. These are the things you've been pushing hard. This motion, and I have great respect for Senator of Taita Taveta, but I find this motion to be contradicting our position as a Senate. What we should be saying is we should be asking our counties to invest more money in our county hospitals. We should be asking the national government to increase allocation or basically transfer all health functions to the counties and transfer with money. But now asking them that now that our governors have failed to manage our county hospitals, now we should again transfer that burden back to the national government. That is not making sense to me, and I do not support this motion on that thinking, Madam Speaker. My thinking is that we need more money to be appropriated to our county hospitals. We need more money from the national government to support health in our counties. That will be progressive. Because if we join this stampede to convert our county hospitals into referral hospitals, Madam Speaker, we will not be doing justice to our people. I do not think it is necessary for us to have referral hospitals all over. What we want is better managed hospitals. Because in any case, Madam Speaker, this idea of referral hospitals, without having proper lower level 5 and level 4 hospitals, it means patients will be referred to referral hospitals, even basic health issues. Referral hospitals are supposed to handle complicated issues. So that is why you find KNH is congested. Because patients want to go there, enjoy better services, and they don't want to go to level 4 and level 5 hospitals. Or level 4 and level 5 hospitals are not properly equipped. So they push all their cases which they are supposed to handle back to the National Referral Hospital. So, Madam Speaker, on the basis that we need to improve the performance of our county hospitals, and on the basis that we need the national government to transfer all functions in health to the counties and transfer with money, I do not support this motion.